Hello everyone. This is Silver Queens. Today, we're going to talk about menopause and heart health. A very important topic for the health of us middle-aged women. Did you know that we need to pay special attention to heart health during menopause, which is a natural stage of our lives? Many of you might think of hot flashes or mood swings when you hear menopause. But it's actually an important period that affects our entire body. Let's learn in detail today about how it's closely related to heart health. During the menopausal transition, that is, a few years before and after menopause, many changes occur in our bodies. The biggest change is the decrease in estrogen, the female hormone. Estrogen is not simply responsible for reproductive functions, but is an important hormone that affects our entire body. As estrogen levels drop, various changes appear in our body, and among them, changes related to heart health are particularly important. First, when estrogen decreases, cholesterol levels tend to rise. Cholesterol is a necessary substance for our body, but it can be problematic if there's too much, especially if LDL cholesterol, known as bad cholesterol, increases. It can accumulate on the walls of blood vessels and cause atherosclerosis. This is one of the main causes of heart disease. Also, blood pressure can rise during menopause. Estrogen acts to dilate blood vessels, and as this hormone decreases, blood vessels can constrict and blood pressure can rise. High blood pressure is one of the main factors that puts a strain on the heart and increases the risk of heart disease. Studies show that postmenopausal women are more likely to experience atrial fibrillation, an irregular heartbeat. Atrial fibrillation is a type of arrhythmia where the heart beats irregularly, which can cause fatigue, dizziness, and shortness of breath. More seriously, atrial fibrillation increases the risk of stroke. This is something that menopausal women should be particularly careful about. Stress and insomnia during menopause can also affect heart health. Mood changes due to hormonal changes, sleep disturbances due to hot flashes, etc., can exacerbate stress, which in turn can put a strain on the heart. Chronic stress can increase blood pressure and cause inflammatory responses, increasing the risk of heart disease. There's also research showing that obese women who experience menopause at a later age have a significantly increased risk of heart failure. Obesity itself puts a strain on the heart, and when hormonal changes due to menopause are added to this, it can pose an even greater threat to heart health. I'd like to emphasize once again the importance of weight management. On the other hand, women who experience early menopause, that is, before the age of 45, are at higher risk of coronary artery disease throughout their lives. This is because they don't receive the protective effects of estrogen earlier and for longer. Women who experience early menopause need to pay more attention to their heart health. But don't worry too much. Menopause doesn't directly cause heart disease. It's just that the changes that occur in our bodies during this time can affect heart health, and these changes can be sufficiently managed and dealt with. Now, shall we look more closely at the specific methods we can use for heart health during menopause? First, regular exercise is really important. The best exercise for heart health is aerobic exercise. Walking, jogging, swimming, cycling are typical examples. It's good to do at least 150 minutes of moderate intensity aerobic exercise per week. Don't overdo it from the start, but start slowly and gradually increase the exercise time and intensity. Second, it's important to maintain a healthy diet. The Mediterranean diet is well known as a diet good for heart health. It's a diet that mainly consumes fruits, vegetables, whole grains, nuts, olive oil, fish, and reduces red meat and processed foods. It's especially good to eat blue-backed fish, rich in omega-3 fatty acids, more than twice a week. Also, don't forget to reduce salt intake and drink plenty of water. Third, stress management is very important. Chronic stress is very harmful to heart health. Try managing stress through methods like meditation, yoga, deep breathing. Sufficient sleep also helps a lot with stress management. Try to get 7 to 8 hours of good sleep a day. Fourth, get regular health checkups. Especially during menopause, make sure to get tests related to heart health. Regularly check your blood pressure, cholesterol levels, blood sugar levels, and if necessary, get an electrocardiogram or heart ultrasound. Fifth, quitting smoking is essential. Smoking is one of the main risk factors for heart disease. If you're still smoking, start quitting right now. Quitting smoking helps not only heart health but overall health. 6th, maintain an appropriate weight. Obesity puts a great strain on the heart. Try to maintain an appropriate weight through a healthy diet and regular exercise. Be especially careful of abdominal obesity, as it increases the risk of heart disease. 7th, consume alcohol in moderation. Excessive drinking is harmful to heart health. Moderate drinking of about 1 glass a day is okay, but it's better to avoid more than that. 8th, consult with your doctor about hormone replacement therapy. While hormone replacement therapy isn't suitable for all women, it can help some women alleviate menopausal symptoms and maintain heart health. Be sure to consult with a specialist to make the best choice for your situation. 9th, maintain social relationships. Healthy relationships with family and friends help with emotional stability and play a big role in stress management. Participating in gatherings with peers who are having the same experience can also be a good method. 10th, start a new hobby or activity. There are research results showing that actively using the brain also helps heart health. How about starting a new activity that stimulates the brain, such as learning a new language, learning an instrument, or drawing? We've looked at specific methods for heart health in menopausal women. It may be difficult to practice all of these at once, but start with small things one by one. If you make steady efforts little by little, healthy habits will take root before you know it. Menopause is certainly a time that brings big changes to our bodies. But if we manage this period well, we can actually live a healthier and more vibrant life. We must protect our own health. It's important to listen to your body and give it the care it needs. Also, don't be ashamed or hide the changes or symptoms of menopause. Talk honestly with your family or friends, and if necessary, it's good to get help from professionals. We are not alone. Many women are having the same experience, and we can help each other. Lastly, don't view menopause only negatively. This period can be a new beginning. The busy period of raising children has passed, and now it can be a good opportunity to have time for yourself. How about starting a new hobby or challenging yourself to achieve a dream you've been putting off for a long time? Our lives are not over yet. Rather, a richer and more beautiful life may be waiting for us. I hope you can open a new chapter of life with a healthy body and mind. Everyone, please remember what we talked about today. Regular exercise, healthy diet, stress management, regular health checkups, and above all, loving yourself. All of these will be the keys to our healthy and happy lives. Menopause is not the end, but a new beginning. After we get through this period well, we will become stronger and wiser. Let's all work together to overcome this period well. I sincerely support your healthy and beautiful middle age. This has been Silver Queens. We support your beautiful middle age.